Ladies and gentlemen, I am Tekki, and we don't do so well on such podiums. So, Miss Barry, if you're a Tekki, I think there are lessons I need to take. My hands have been sweating. I've been trying to wipe them for a few minutes. Yeah. So I'm dressed similarly to Miss Speaker because in my book, this shirt can pass as a formal shirt because I believe health needs to be taken seriously. I am in jeans because in as much as we take health seriously, it needs to be easy as well and simple. Okay. So I will start. At Damu Sasa, we believe that technology, if well leveraged, can contribute immensely to the delivery of quality healthcare. And for the various speakers that have been here, with technology, right now, remote diagnostics can be done. So a patient in Turkana does not need to travel all the way to Nairobi to see a doctor. So Damu Sasa is another perfect example of a technology-based solution that is working to solve the challenges in blood services management within Kenya currently. In blood services management, there are quite a number of challenges. So for example, the National Blood Transfusion Service in Kenya notes that we need about 500,000 units for patients every year. Unfortunately, we collect less than 40% of that. Worse still is that out of the little we collect, we still go ahead and lose most of it out of things such as expiry and cold chain violations. The working estimate right now is that we lose about 800 to 1,000 units every quarter. So given that one unit takes about 10,000 shillings, it means that we're losing about 10 million shillings every quarter due to something that is avoidable. The lack of available blood means that it's the delivering mother that pays for it with their lives. It's your brother, your sister who's suffering from cancer. It's your colleague from work who's been in an accident that suffers from that lack of blood. So Damu Sasa works to solve these challenges using technology. So leveraging on technology, Damu Sasa helps to manage the entire value chain of the blood services ecosystem. So we have solutions that support blood sourcing. We have solutions that support donation management. We have solutions that support inventory management. We have solutions that support transfusion management and even hemovigilance. So Damu Sasa was piloted in one of the largest referral facilities in East and Central Africa, that is the KNH, and to visiting colleagues from East Africa. I don't mean to brag, but we are told that KNH is the largest referral facility in East and Central Africa. I hope you will take that as a challenge to build better, bigger facilities in even Ethiopia, so that because when you build bigger facilities, it's the citizens that benefit. Because if I was in Ethiopia, I would want to go to a bigger and better KNH if possible. It would really be nice. So Damu Sasa has been presented to various stakeholders, and it was out of that that we ended up doing the pilot at KNH. Together with KNH, we're able to raise the blood availability scenarios, we're able to reduce the potential loss of units, and out of that, we've been able to see faster discharge rates of patients that would ordinarily have to wait for blood for 2 weeks, not because blood was unavailable, but just an issue of the management of the entire process. So we've also seen reduced mortality rates, especially in the oncology wards. And this actually works to just show you the power of technology if well leveraged. So during the unfortunate Dusit D2 attack here in Kenya, Nairobi, the KNH using Damu Sasa, and at the click of a button, were able to mobilize over 1,500 donors to come and donate blood at KNH. So we believe that that was a success rate of about 47%. We believe that if this is rolled out across the board, every hospital facility in the country, we can even get better results than that 47%. We realize that the biggest pain point in blood services management is the relationship between donors and the transfusing facilities. So you realize there's some sort of disconnection between the people who donate the blood and the facilities that receive the blood. And one of the biggest challenges in healthcare is disconnected healthcare. So we endeavor to try and connect these donors to these facilities, and we've actually seen a success rate of about 47%. And that's why when we had DUCIT, 1,500 people turned up. Like I said, Damu Sasa has been well received by stakeholders in the blood services management ecosystem. These are the counties. Recently, we signed Muranga, onboarded into the Damu Sasa platform, Muranga County. We're looking forward to onboarding more. Damu Sasa most recently won the Quality Healthcare Kenya Awards 2019 for best use of technology to improve primary care. So out of this, Damu Sasa has also been recommended for use by the ICT Authority of Kenya, as well as the Kenyatta National Hospital. One more thing is that given that the blood services ecosystem and being a startup wanting to contribute as much as we can, the module on Damu Sasa that is associated with donor relationship management in partnership with AMREF, we are giving free access to it. And this accounts for about 30% of Damu Sasa's value. So if you're a facility, transfusing facility, and you wish to use it, it's free of access. You can just get in touch with us and you can be onboarded onto the program. Ladies and gentlemen, out of technology as well, we've built in AI based on the feedback that we receive from the users. The incident at DUCIT was reported way before patients, the victims, started being ferried out as patients. So KNH was notified of the blood availability. So the attack as DUCIT has happened. The system would check whether KNH had enough blood reserves to accommodate the likely patients that would come as a result of that attack. So, and many more. We have systems that indicate, suggest rather, on what component of blood to use. Like, for example, if a mother is suffering from PPH and all they've been given is whole blood, the system is likely to suggest a change in the component being used from whole blood, maybe say to cryoprecipitate. The work to be done by Damu Sasa is far from being complete. Accordingly, we are calling on stakeholders to help us in this journey. One, to roll out this solution further across the board. These are the counties, visiting governments as well, and other healthcare practitioners, even in those involved in other issues, other consumables associated to healthcare and blood services. For example, we've presented Damu Sasa in many fora, and someone once walked up to me and said, I like the solution and I'm going to sign up for it. The challenge, however, is that if you are able to bring 1,500 people to KNH and you bring me 1,500 people to my small facility, I may have to turn some of them away because I do not have enough blood bags, for example, to deal with all these people. So as a result, we realize that if we're to offer a full spectrum solution, we need to partner, which is something that has been mentioned quite strongly in this conference, and we are appealing to such partnerships. Damu Sasa has and will continue to innovate in a bid to make blood services more accessible to common citizens. Our goal is that every patient should have blood when and where they need it. Thank you very much.